Hello, I'm Dr. Julie Schell from Bottom Vet Hospital, and today I'm going to show you how to syringe feed an animal who has a little bit of a picky appetite. So the food of choice that I'm using today is a really nice urgent care diet. It's called Prescription Diet AD. And we like it warm. I always like feeding animals at body temperature. That's when their enzymes can absorb food the best. So I'm just going to put a couple teaspoons on a plate, and you can either use hot boiling water to warm it up, or most people have microwaves, so we'll use that. I don't microwave it very long because it can damage the food a little, and so I just microwave it a little bit. I'm going to put a Kleenex on top, like a little splash guard. So just want to do it for literally 15 seconds at the most. And we're going to be helping out a little dog named Nikita today who is diabetic, so it's very important that she eats food. She's nurturing through a surgery from her eye, and so she is on a special diet and a lot of medications, and she even had to wear a cone on her head, so it kind of is uncomfortable for her, so we want to just get her eating again. So the food is nice and warm. Again, you can use boiled water for this as well. And I just mix it up so that there's no signs of any hot spots. I'm always touching it with my fingers too, and making sure that there's nothing like a hot pocket. And you just want to slather it out on a plate, and then you take a clean syringe, and basically syringes come like this, so you want to undo the syringe, and to fill the syringe you just kind of stack it into the syringe in an anterograde fashion, and you just want to keep doing that till it's near the top of the syringe. And this also helps cool the food too a little bit. And then you just kind of wipe the edges of the syringe out to make it easy. You get rid of the air bubble. No dog likes to have air sprayed in their mouth. I also test it to make sure it's not too hot, so it feels like body temperature, which is my favorite temperature. With Nikita, she's a pretty good dog. I'm not going to hassle her too much. Sometimes she wants to lay on a towel, sometimes a blanket, sometimes nothing. So I just kind of put that in front of her, and I'm just going to wait for her to pant. This is a very unique situation because some dogs will do this, some dogs won't, but you just kind of wait for her to open her mouth, and you shoot some in her mouth, and she swallows it. So it's a very, not a very painful thing at all. And you just wait until she opens her mouth again. Now sometimes when I see them start licking, I actually will offer them a little bit from the plate, so you can just see if she wants to eat it on her own. She's quite distracted, so I don't think she will. And I'll just kind of try it again on her. Good girl. So even if you get it on her lips, she'll lick it off. I will kind of tempt them. Sometimes I'll like put some on the floor in front of her. We always clean our floors and everything, so they're very clean. But you can put it anywhere. Some people will put them on their paw, and they might lick their paw. But I kind of recommend just in her mouth like that when you get a chance. And you always want to encourage her and reward her. She's such a good girl. She likes baby talk, and a lot of animals do. So I always want to reward them with baby talk. Good girl. Hi, Nikita. Hi. So see her eye, that's what we're focusing on to fix. And just kind of give her some more. And so you can do this about 3 syringefuls for Nikita is what we've been doing in a row, and that usually is enough for a full meal. And then as I find that she's eating better on her own and is like more hungry, then I give her less via syringe because I want her to eat on her own. So yeah, so if you have any questions, give us a call. It's 403-278-1984, or check us out online at www.bobottomvet.com. Thank you very much.